There's one symptom that shows up so gradually, so painlessly, that most people simply adjust their shoes and move on with their day. And yet, it's one of the symptoms doctors are trained to take seriously every single time they see it. Today, I want to explain exactly what it is, why it matters more than people think, and how to tell the difference between the ordinary version and the version that needs attention now. My name is Dr. Lawson. As always, I'm an AI-assisted educational persona, not a replacement for your own doctor. What follows is general information to help you recognize a pattern worth mentioning at your next appointment, not a diagnosis of your own situation. Tell me in the comments if you've noticed this one yourself. I have a feeling more of you have than you'd expect. The symptom is swelling in the ankles, feet, or lower legs, what doctors call edema. It's easy to dismiss. Shoes feel a little tighter by evening. A sock leaves a deeper mark than usual. Most people assume it's just from being on their feet, the heat, or a long flight. Most of the time, they're right. But persistent or worsening swelling, especially when it shows up on both legs and doesn't fully go away overnight, is one of the more reliable early signals your body sends when several different systems are working harder than they should be. Here's why it happens. Swelling occurs when fluid isn't being moved efficiently out of the tissue in your lower legs and back into your bloodstream. Three systems are usually involved in that process. Your veins, which return blood to your heart itself, which needs to pump efficiently to keep circulation moving, and your kidneys, which manage how much fluid your body holds onto in the first place. When any one of these three is under strain, fluid can start to pool lower in the body simply because gravity pulls it downward, and the usual pump and drain system isn't keeping up. Let me tell you about someone I'll call Robert. Robert is 69, active, and had noticed his ankles looking a little puffier by the end of most days for a couple of months. He assumed it was just from gardening because he spends hours on his feet. He started elevating his legs in the evening, which seemed to help, and didn't think much more about it. At a routine appointment, almost as an aside, he mentioned it. That small comment led to a blood pressure check and a simple conversation about his heart and kidney function. It turned out his blood pressure had crept up gradually over the previous year in a way that hadn't shown up as any other obvious symptom. The swelling was the first visible clue. Robert's story is a common one. The swelling itself usually isn't dangerous. Mild swelling, that's worse by evening, improves with elevation or overnight rest, and affects both legs roughly equally, is common. It's often related to being upright for long periods, warm weather, or minor circulation changes with age. But there's a different pattern worth a prompt call to your doctor. Swelling in only one leg, especially with pain, warmth, or redness, can point to a blood clot and needs same-day medical attention. Swelling paired with shortness of breath, chest discomfort, or rapid weight gain over just a few days is also something that shouldn't wait. That combination can point toward the heart or kidneys needing a closer look. If this is helping you think about a symptom a little differently today, this is a good moment to subscribe, because the fix for the ordinary kind of swelling is simpler than most people expect. Here's something that surprises people. Salt is often blamed first, and while reducing sodium can genuinely help, one of the most overlooked contributors is simply prolonged sitting or standing without moving. Something as simple as flexing your ankles and calves for a minute or two every half hour when you're sitting for long stretches, whether during a long drive or while watching television, can meaningfully help your circulation do its job, often more than people expect from such a small habit. Here's what I'd suggest. If you've noticed this pattern, start simply. Elevate your legs above heart level for 15 to 20 minutes in the evening a few times this week, and pay attention to whether it improves. If it does, that's useful information to share with your doctor. If it doesn't improve, or if you notice any of the warning signs we just covered, that's the moment to bring it up sooner rather than later. If you found this useful, type the word ankles in the comments so I know you made it this far. Swelling in the legs is easy to dismiss because it's painless and gradual, but that's exactly why it's worth paying attention to. It's often your body's quiet way of flagging something worth a conversation well before anything more serious develops. If this helped you think about it a little differently, subscribe for more of these breakdowns, and I'll see you in the next one.